Welcome to Medicare 911. Today we're going to be going over the differences between original Medicare and the Medicare Advantage plans, just comparing them two. We're also going to be talking about commissions and other things. So let's get started. When we look at original Medicare, the first thing that we're going to look at is it's nationwide. Your Part B premium is going to be the base rate's $134. And we also talked about what your income, based on your income, how much your Part B premium would be. Then also, when we look at the Medigap supplements, you're looking at between $50 to $200, a little bit less than $200 a month, depending on which plan that you go with. And then also your prescription drug plans, depending on the area you live in, but they're going to be approximately around $17 a month for the prescription drug plans, or more depending on what drug plan that's best for you. So when we look at these items, you're looking at between $200 and $350 a month. So like I said, with original Medicare, it's nationwide. There's no network. You can go to any doctor you want. So if you're down here and you're seeing a doctor, you live here in Florida, and then you want to see a doctor in Texas because maybe he's the best doctor for the aorta split, you can go there. So come up here and we look at Medicare. So Medicare is first, and then your supplement just follows Medicare no matter where Medicare goes nationwide. So your supplement plan just follows Medicare. It fills in the gaps of Medicare. It's second. If Medicare, original Medicare, you're in Maine, North Carolina, South Carolina, Nevada, the supplement just follows wherever Medicare goes. If you're in California, all you do is ask the doctors or hospital if they take original Medicare. If they take original Medicare, then you're fine. Your supplement just follows. And then with original Medicare, the third thing that you would get is your prescription drug plan. And there's a video that we have on that. There's about 20 different drug plans in most areas. And if you watch the video, you'll see how to get the best drug plan for you based on the medicines that you take, and also based on the pharmacy that you want to go to. So when we come over here to option 2, we're talking about Medicare Advantage plans. A lot of the Medicare Advantage plans are $0 premium, but you still are going to pay this Part B premium depending on what your income is. So the base rate's $134. So you're still going to pay that. On a Medicare Advantage plan, though, you're going to have one insurance card. And on that one insurance card, it's going to be for your doctors, your specialists, your hospital coverage. On a lot of them, there's a prescription drug plan that comes with it. It's going to also, cover your test, emergency room. And then we're going to talk about some of these other benefits down here in a minute on some of the Medicare Advantage plans. On a Medicare Advantage plan, you leave original Medicare and you're still in the Medicare system, but you leave original Medicare and you come over here and you pick up a Medicare Advantage plan. So you can no longer use this red, white, and blue card for your doctors and hospitals, because you left that. So they're also known as Medicare Part C or Medicare health plans. And the very first thing people should realize is they are not nationwide except for emergencies. So when we look at these, you come down here and you look at these Medicare Advantage plans, your network might be, if it's a regional PPO, in Florida, it would be the whole state of Florida, which is set by Medicare. Or you might have PPO, and a PPO, it might be Southwest Florida, and if you go out of network, so if you want to go out of network and see another doctor who's not in network, you're going to end up paying more on a PPO. So regional PPO and PPO, you can go in network and out of network. If you go out of network, you have to pay more. And then when you look at HMOs, they're a lot smaller network. And if you go out of network and it's not an emergency because you want to go to Atlanta maybe to see a specialist, and if they're not in network and you don't have prior approval, you have no coverage. You're going to pay 100%. And then the other thing that you need to be aware of is this part right here. So when you look at these Medicare Advantage plans, there are doctors and hospitals that do not take Medicare Advantage plans. So there are cancer hospitals in Florida that will not take Medicare Advantage plans. I spoke to the #1 hospital in the country, and they are not in network, and they're in Texas, and they are not in network on any of the Medicare Advantage plans. That's another thing that people need to be careful of. Just because something is free and it doesn't cost them anything, there could be a cost down the road. So on Medicare Advantage plans, if there's zero premiums, that should raise a red flag. I offer Medicare Advantage plans. So on Medicare Advantage plans, they pay me $400 to $500 commission. That's my commission. Where on one of the best plans that you can buy over here on original Medicare, this high deductible F plan, it's only around $50. My commission on one of the best plans for you is only around $80. If I put you on a Medicare Advantage plan, I'm going to make around $400 to $500 commission. So this should kind of give you an idea sometimes what the motive is behind agents that are pushing Medicare Advantage plans. I'm very transparent. I tell people how much I make, and because the things that pay me the least, like these Medigaps and supplement plans, they give you nationwide coverage and they follow original Medicare. I've had people crying. They weren't clients of mine. They were referred to me, and they just got diagnosed with cancer, and they find out that the cancer hospital will not take their Medicare Advantage plan. The other thing on a Medicare Advantage plan, if you go to a doctor, they normally have copays. So this is just for an example. So it might be a $15 copay. A specialist might be a $35 copay. Hospital, around $400 for the first 4 days. Some are a little bit less. They might include a prescription drug plan, but there's only one RX plan. You don't have a choice of 20 like you do with original Medicare. On these prescription drug plans, there's going to be about 20 in your area that you could pick. So when I run people's medicines, generally about 80% of the time, 90% of the time, they save more money on original Medicare on the drug plan than on Medicare Advantage plans. And that's just my experience. So testing, you're going to pay around a 20% copay, and then emergency rooms around a $75 copay. What I'm talking to you about, this is 2017. Some of the drug plans include a gym membership. We're talking about basic routine dental, so 1 or 2 cleanings a year. But if there's periodontal, if there's bleeding, you may have to pay for it. Vision, it's a basic eye exam for glasses. It has nothing to do with disease of the eye. So up here under specialists, this is where your specialists are for disease of the eye, for glaucoma, cataract, etc. And then your basic hearing test. With original Medicare, over here, all the money for original Medicare goes towards Part A and Part B. So Part A is for your hospital, and that's right here on this card, right? And then Part B right here is for your doctors, your medical. But with a Medicare Advantage plan, the federal government sends the money over to the Medicare Advantage plan. So you have this money that's sent over here. And on a Medicare Advantage plan, the money that's normally used for doctors and hospitals, money's taken away from over here to pay my commissions. Money's also taken away and used for the prescription drug plan, because nothing's for free. The money has to be coming from somewhere. The money's also taken away from up here to use because people want silver sneakers, a gym membership, and then money's also taken away from doctors and hospitals for basic routine dental, vision, and hearing. So what's happening in this area, what's happening is that doctors and hospitals, they're getting paid less and less because you think that you're getting all these extra benefits for free. So there's a place for Medicare Advantage plans. About, I would say, less than 20% of our clients have Medicare Advantage plans. 80% of our clients or more are on original Medicare with a Medigap supplement plan and also a prescription drug plan if they need it. Option 2, Medicare Advantage plans, pays me the most money, but it's less than 20% of our business because I'm very transparent and I tell people ups and downs between the two. Original Medicare is about 80% of our business. There are some people that just do not have any money at the end of the month. So $50 a month, they just can't afford it because some people's Social Security benefits are very low and they don't have anything else. So there's a place for it, but it's buyers beware, buyer beware. As we get older, our health insurance should get better. So our coverages should get better. But what happens with a lot of people as they get older, they end up choosing plans that are not as good as original Medicare, and things are more likely to happen. Okay, so now that we compared original Medicare with option 2, which is the Medicare Advantage plans, the last thing that we should be looking at is out-of-pocket maximums. For your Medicare Advantage plan, if you stay on in-network, some of the plans, the maximum out-of-pocket in-network is $6,700. That's your co-pays and deductibles for your doctors and your hospitals. That does not include prescription drug plan that comes with the Medicare Advantage plan. And then if you go out of network on a PPO or a regional PPO or a plan that's similar that has in-network and out-of-network coverage, then your maximum out-of-pocket can go up to $10,000. If you're out of network or someone's out of network and they have a $100,000 cancer bill, and the insurance company that your Advantage plan is with approves $60,000 in coverage, that leaves a balance of $40,000 that you're responsible for, the difference between the amount that they approved and the $100,000 that was originally billed. Then also on top of that, your maximum out of pocket's $10,000, so you're going to pay an additional $10,000, which is $50,000 on a $100,000 bill. And then the Medicare Advantage plan, they approve $60,000 minus your maximum out of pocket, the $10,000. So the insurance company is going to end up paying approximately $50,000. Something that is free. So up here we see the Medicare Advantage plans. A lot of them might be $0. You still have the base rate of your Part B premium, which is $134, depending on what your income is. So they are not nationwide. If something's free, you just have to look at it closely and look at the pros and cons. So because it should raise some type of red flag because there's nothing that's free. And just remember, there's doctors and hospitals, even if you go in network. So let's say you had a regional PPO as the state of Florida, that's the network. There's still doctors and hospitals in Florida that do not take Medicare Advantage plans. Where when we looked at option 1 up here with original Medicare, they're nationwide. And then Medicare Advantage plans pay me more than Medicare supplements. Medicare supplements, my commissions are less. On these Medigap supplement plans, if an agent's selling a Medigap supplement plan in this area, let's say the F plan is $200 for an A-rated company that has low, consistent rate. And then another company comes along and they sell the F plan. All the benefits are the same, but it's $300 a month premium, and it might be a B plus rated company. Why would an agent sell the same plan with a different company for $300 when it's available in your area for $200? Well, commissions. So there's also Medigap supplement plans that also pay higher commissions. They have higher premiums, and there's no benefit to the client also. If you have any questions, let us know. I hope this is helpful, and we want to be 100% transparent. That way you know what you're doing. It's your health, it's your life, and we don't want to see you make any mistakes.